Hello, students, and today we're going to discuss a very important part of the health assessment is the mental status examination. It's a very important part because our patients are not only having problems, physical problems, but they can also have other problems such as disorders of mental health and substance abuse. The mental status examination is a good way to gather information regarding the patient mental health. Mental status is the total expression of a person's emotional response, mood, cognitive function, and personality. When we talk about the mental status, is how the person thinks, how the person feels, how the person looks in the affect. So it has different parts, but it's closely related to what we think and what we feel. The mental status examination is one of the most important parts of the examination in psychiatry because it gives us a way to observe different behaviors of the patient. The mental status examination is observable, so it's why you're looking at it. That's why you have to become good at it. We have to think about our brain and the way our brain works. We know that the frontal lobe is this part which is special and where we have all these thinking and those executive functions, our short-term memory, and also our goal-oriented behavior. When we look at the different parts of the parts of our brain, we know the different parts work with different functions of our body. For example, the parietal lobe is closely related to sensory perception when we touch, when we feel hot or we feel cold, and to spatial sense and navigation, such as when we go down the stairs. The temporal lobe is closely related to perception and interpretation of sounds. It's also where Wernicke's area is, and is also related to long-term memory. The limbic system, or everybody always said, is the part where all our feelings and behaviors of aggression, anger, or love could be there too. So it's related to emotions. So this mental status examination may be viewed as equivalent to the physical exam in psychiatry, and is very important component of the neurological examination. So there are several factors that might affect the mental status exam. And one of these factors could be educational and cultural. Remember, some cultures do not look you in the eye. Some cultures might not be very verbal in response. So you might think that behavior is abnormal, when in reality, for their culture, is a normal response. So when we look at the components, one of the things that we want to see is the appearance. Are they well dressed? Are they dressed for the occasion? Do they look raggedy or do it over, histrionic? We want to see the motor. Are they shaking? Are they rocking in the chair? Are they still? Are they using their hands? How is the speech? Is rapid? Is very slow? You cannot hear it. How do they look like? Do they smile? Do they have eye contact? Is the affect related to their mood? And mood means what they telling you they feel, and affect is what you can see. Thought contents is about, for example, if I think I'm the president of the United States, that is a delusion because I am not. So thought content is about what I'm thinking. Do I have suicidal ideation? Do I have homicidal ideation? When I talk about thought process, it's about logical process of thought. For example, I am talking about how is my day. Oh, my day is a good day. Today is sunny and happy. And I can give you some kind of explanation that is logical and order. In persons who have mental health disorders, that is not going to happen. They are going to have different ways that they go they relate the information to you, which might not be logical. Perception is what we see with your eyes. For example, if I'm next to the classroom, I can see chairs, I can see the blackboard, I can see the computer, but if I have problems with perception, I might be having hallucinations or having delusions. I might think that the chair is an elephant, or I might see something where nothing is, which is a hallucination. Intellect is how can I make, for example, can I read? Can I do certain tasks? Can I have understanding? And insight is about judgment. Can I make good judgments about, everyday things? So this is kind of like, in a nutshell, what is the MSE? When we look at appearance, we already talked about you have to be observant of the age, the gender, the posture, eye, the grooming. Are they attentive? Are they responding to you? Are they alert? The motor, of course, you have to document if the patient is agitated, if they have a normal movement, if they're moving their mouth, or they're moving their eyes, or they're not moving at all. So this is a very important part because it will tell you the patient is having a problem. For example, patients who have severe anxiety, you're going to see them rocking in the chair. You're going to see them probably sweating. You're going to see their eyes popping out. So it tells you a little bit about how they feel. Speech, very important part. Persons with schizophrenia will have problems with speech. Persons with bipolar, their speech will be very fast. The rate fast, the rhythm, the volume will be probably high, and the amount and articulation. So that's another part of the mental status examination. Here is what we have to be very, for us nurses, we have to be completely aware of the affect and the mood. Sometimes they don't match. Patients might be telling you they're very happy, and you can see their eyes, you can see how they feel, and they might be telling you another information. So you have to, you know, dig in. I will say, ask open-ended questions and try to reach out what is exactly what the patient is going through. Remember, some of the problems that we have in healthcare has to do with suicidal ideations, and we have to make sure that the patient is safe. Of course, the mood can be um, assessed by asking the patient how they feel, but the affect is what you observe. The thought usually is a description of at least two categories: description of the patient's process and the content of the thought. So we said thought process and thought content is a very important part when you want to find out if patients are having problems with psychosis, schizophrenia, and so on. So in the content we talked about before, patients might have problems with suicidal ideation, homicidal ideation. There are ways to ask questions. There's several scales that we can use, and we can assert if the patient is suicidal, or if the patient is having paranoid ideations, delusions, and other kind of thinking that might put the patient and others at risk. The important part here is that we need to make sure that patients are safe in our care. The process describes the manner and organization of how the thought is formulated. A coherent thought is clear, is easy to follow, and is logical. A disordered thought of thinking tends to lack coherence and might affect the language and the communication. So here are some examples. For example, I got a patient that told me, "Oh, I live." Instead of saying that I live in the beach, he said I live in the condominium beach or something. He made a new word for it, that he lives in the beach in the water. So they tend to do something called word salad. They can be tangential. So it's different ways to express, but there's not logical, and that's why it shows you the process. So here you can have examples of tangential thought or circumstantial thought or loose associations, and they have something called word salad that you don't understand anything. They just have a lot of words. They don't mean anything together. So here's more examples of neologisms and word salad and clang associations. Now, perceptions are very also important because patients tend to have more problems with auditory hallucinations, especially the patients that have problems with psychosis and schizophrenia. They can also have, visual hallucinations. Patients who have alcohol withdrawal um, may have tactile hallucinations. So we have to differentiate between what is an hallucination and an illusion. It's very important because an illusion, you think you're looking at something. Some of the patients that, for example, patients who are intoxicated with cocaine might have illusions or seeing things that are not real, but they can see things, but they are not what they think they are watching, like they might be seeing monsters and they are actually trees. So they have problems with the perception. Intellect, we want to know if the patient has an average intellect or above the average or below average intellect. And insight and judgment is what we actually refer to tasks that require a good deal of cognitive function. So, for example, some of the problems with patients with schizophrenia is that, let's say they want to go and get milk, they might not be able because they're going to start thinking, should I get the milk? Should I not get the milk? What happens if I go get the milk? So they're not able to do that. And this is something about the judgment and about their insight. So another important part is the cognitive exam, because we want to make sure the patient doesn't have any problems with dementia. And we want to know if the patient, for example, we always ask them that question, who are you? Tell me where you are now. Can you tell us what day is today? Who's the president? We can ask them about attention and concentration. We can give them few words and tell them to repeat it later. We can also, ask them to touch our fingers when we move our fingers, and we can ask them to do abstraction and conceptualization, such as asking them what it means when dogs that bark do not bite you. So what is the meaning of that say? So you can ask them any meaning, and they will tell you, like loose lips, sun chips, what that means. So you can ask them questions like that. You can also make sure that the patient is able to concentrate and have attention. You want to know if the patient might be having delirium. This is one good thing to ask them. And memory is one another important aspect that you want to test in patients. So memory is divided in different parts into registration, short-term memory. In registration, you can tell them, I'm going to give you 5 things, and in a few minutes, I'm going to come back and ask you for those things. And short-term memory is something that you can tell them, and they have to repeat it. But long-term memory is something to do with procedural memory. For example, driving a car is procedural memory. You don't remember the steps. You just go and do it. It's a procedural memory. So some patients with Alzheimer's, we have problems with procedural memory. So visual spatial ability is about the ability to recognize the relationship in objects. So I can put a coin in your hand and I'm going to tell you, what is this? You can answer that. You can also have a false mini mental status examination, and you can construct a task, and you can ask the patient to draw intersecting pentagrams. Or they can, draw a clock with it. with the clap hands. So that's another part. And instruction is about telling them about, for example, some kind of say, and they have to understand what you're talking about. So that concludes my presentation. I hope you got some questions. You can always contact us, and thank you very much.